Hello everyone, this is Dr. Khan, Executive Plastic Surgery, Bloomfield Hills, Michigan. I have a wonderful patient of mine. She is actually 3 days out from her surgery, and we want to take this chance to kind of learn from her experience. I think she has a lot to offer. She's 64, coming to us all the way from Idaho. And so she and I did the phone consultation, and there was on initial presentation, we had what was a ruptured right breast implant. We had an MRI done which showed what was a dual lumen. That means there was saline and silicone implant. The right one was indeed very much ruptured. And so she is now 3 days out from her surgery, so we want to learn from her experience. Now, having said this, let me ask you this. When did you hear about breast implant illness? When did you know that it was affecting you, or this was it?
Actually, I think that I was truly introduced to it when I started researching after I saw that my breast was ruptured or rupturing, whatever.
When did it rupture?
In February.
Okay, of February. Okay.
Yeah, late January, early February.
Of this year.
Of this year. Mm-hmm.
Okay, what happened? What did you notice?
I got out of the shower and I looked in the mirror and I'm like, oh my goodness, it's rippling and it's smaller. Mm-hmm. And I had my husband look at it to make sure that I was seeing it correctly.
Right. So this is one thing very important, that saline implants are like a water balloon. When they do rupture, there's a dramatic size difference between the other side or from before, and they essentially collapse. Now there is the volume of that the volume of the capsule that's present. There is a volume of that shell of that implant that's present. So it's not completely like zero. There's still inflammation that's present. Sometimes there's fluid that is still present. Mm-hmm. And so there is, quote unquote, but there's a significant decrease in the volume that is notable compared to before.
Right.
Versus silicone implants, when they do rupture, you could have a normal exam and still not know that you had a rupture. Mm-hmm. So you noticed and you started doing the research.
Right. I went right ahead and the first thing I always do, I'm like a YouTube junkie, and I just started looking at taking the implants out. I had tried 2 different times, about 5 years ago and about 7 years ago, roughly. Inquiring about having them out just because I knew that they were old and they weren't supposed to be.
So you had your implants from 1996?
Yes.
So this is when the silicone implants had just been banned 4 years ago in 1992. And so this is in 1996 you had gotten your set of implants, the one and only set that you have?
Yes. Mm-hmm.
Okay.
Yeah, I actually, just to insert this here, since we're talking about it, the reason I waited so long is because of the cost. It was going to cost us to have them out. You don't think it, or I didn't think about that when I got them in. I didn't think about anything. I was just glad to have breasts. So anyway, but I did try a place. I'm from Idaho and in Boise at that time, and it was going to cost like $12,000 to have them out, and I just wasn't getting a very enthusiastic welcome to that prospect. They didn't seem very open to be doing it. Told me to try Utah as well. So anyway,
what do you mean by that? Like you went to your plastic surgeon in order to get them removed, and what were they saying?
I actually called just to inquire how much the cost would be to have them removed, and that's where I just didn't get a real enthusiastic, thing. That would have been about 7 years ago.
All right. Okay.
Yeah. So anyway, when I saw the rupture, and I'm moving forward to in late January, February, it was forcing our hand. I knew I had to do something, and then you just have to leave it to the good Lord to take care of the rest, and so that's what was on our mind. But anyway, so I immediately went to YouTube and started looking at what it would take to have it done, because I realized there'd probably been a lot of technology since in the last 7 years. Hopefully I'd have a better reception for having them taken out. And you were one of the first ones to come up. And that was really something to me, because I did watch other people. I kind of just I usually watch their personality first. You know, I watch the way they behave themselves or the way they communicate or not. And if they have a certain amount of arrogance. And I mean, I do the whole CI thing.
Yes. Yeah.
But anyway, so then I went online and I put in executive plastic surgery, and I found you, and I could not believe you had so much information just right there for the person to look at and understand what was going to happen, you know, where to stay, everything to help, especially us from out of state, you know, that aren't familiar with this part of America, to be able to visualize right away what it was going to look like. So then I decided to call one of my surgeons in Boise there, and they still weren't very enthusiastic. This was a different doctor, and the front office was very kind of like, oh, we just came to work today, we're just nice, and that's what we do, you know. And when I called your office, they were so good right off the bat. It was just so wonderful to be spoken to that way, to be considered that way. Well, so I kind of wander a little bit here, but what I wanted to say...
No, it's your whole experience,
yes.
right? Yeah. See, the most important thing, if I may jump in, you did your homework.
Yes.
You saw the videos. And what I want to do here is I want to explain to the patients, you have to do your homework. Just go and listen to the plastic surgeon himself or herself. Don't listen to the medical assistant, the PA, the nurse practitioner, or the physician assistant. You have to talk to the plastic surgeon. You have to see the pictures and the videos of the chest wall showing complete removal. You have to see that enthusiasm from your surgeon that he or she is going to remove the whole capsule. Anyone can remove the implant. Now, in your case, you had a dual lumen, because going into your case, I was thinking that there is extravasated silicone, because that's what the MRI radiologist is reading. That dual lumen meaning there was silicone and also saline. What the manufacturers did previously was they said, we're going to make an implant that's saline and along with silicone that's within, so that it's kind of the best of both the worlds, if you will. And, you know, in your case, you knew that it was a textured implant as well. And so you want to do your homework. You want to do your research. You want to see the pictures. You don't want to just listen to one or two lines and say, okay, I'm making my commitment because it's convenient. You took a whole lot of effort. You are far away. You're 6,000 feet elevation. You're literally in a different country, if you will, right? But you knew exactly what and how. What's interesting and ironic about the whole thing is there was a symposium that I was basically discussing with other plastic surgeons, and the many other plastic surgeons that I've discussed with. Each one of us has their own way on the job training of doing this, believe it or not. There is no textbook that says, okay, step one, step two. Most of the plastic surgeons, if not all, are putting in drains. They're fixated in doing a lift. If you ask them deep down within, show me the pictures of the videos, they're not taking the pictures of videos. They're not showing cutting open the videos of the implant capsule coming out, and also of the chest wall, because I find that is key. Because that is the complete transparency. Yes. All what I want to see, if I'm a plastic surgeon or if I'm a patient, I want to see the pictures and videos, high definition, of the chest wall showing complete removal of the capsule, number one. And number two, on the table, cutting open, just like your Facebook Live, cutting open of the implant capsule and all of that inflamed tissue, so that the patients know that this is exactly what was done. And there is a complete, honest, sincere, dedicated, very thoughtful approach about doing this, that there is pure concern for the patient's post-operative well-being, because your post-operative outcome, as you go back to Idaho, you have that absolute peace of mind that two things were done. Number one, all of that capsular tissue and the inflamed tissue was completely, sincerely removed, number one. And number two, all of it was tested, so that there is no second guessing the surgeon, there's no second guessing if there was left behind. And it's all about that peace of mind that it was tested, and that lymphoma was ruled out, breast cancer was ruled out, anything bad like squamous cell cancer. And there are many other associations, rare, but they still must be ruled out, so that over the next several years, you have that peace of mind that there is no potential badness left behind.
Right.
And so that is very much the key. And you want to have that sense of enthusiasm from your surgeon that he or she is excited about doing the explant. You should actually say, I don't want to remove the capsule, and see what the surgeon says, because that way you get your answer. If they're not serious about removing the capsule, I will tell you, in my practice, I would say you do not want to be second-guessing your surgeon. And like the many other patients, unfortunately, that I've taken care of that come to me for residual capsules, you don't want to be in that second surgery phase. Now you're getting that complete surgery done the second time. You want to do it right. You want to do it once. You want to do it with definitive certainty and transparency. You want to see the high-definition pictures and videos. And you want to have that peace of mind that all of it was removed and all of it was tested. Yes, please.
Now that you've said that, I do want to say that after I spoke with the surgeon in Boise there, I started doing a rating system, and I think I had mentioned this to you the other day. Have from the office to the surgeon, and everything you just said is what I found in you, and very little of that enthusiasm or that surety or that feeling in my heart, in my soul, that I just knew I was going to be well taken care of. And I'd never met you, but I could see it from everything that you had done to express yourself, to show your work, you know, on YouTube and on Facebook, and through the ladies also, their testimony of you as well.
Very important.
Yes.
So the biggest and the best confidence that one can get is to talk to the surgeon's previous patients and get all of this in a very nice defined way. So I have someone who posted, and again, with all due respect, I do not know who even the surgeon is, that this is how she looks. I say, does your surgeon still augment? Because if they are, chances are they're not firm believers in breast implant illness. So why would someone want to augment and at the same time explant? So someone who's only explanting, and it's not only someone but that whole group. Number two, they should have a track record of doing it in the time limit, not in an hour and a half, but in at least the 3.5, 4 hours, 5 hours, whatever length of time it takes. You have the high definition pictures and videos that complete total capsulectomy was done, as you have gotten now. Number four, the incision length is very enough. The diameter of the implant dictates the length of the incision. And number five, the social media personality, where you know with confidence that the presence on social media that this patient has gone to a surgeon who really knows what they're doing, and it's not more about, hey, I can do that too if you want for you and we'll give it a shot. No, you want to go in with definitive certainty, and someone who's doing this repeatedly, because I'll tell you, this is a surgery that is relatively very physically challenging, mentally challenging, and especially when the surgery gets involved, it's not only the entire implant and the capsule, but that inflamed tissue around that needs to be certainly very much removed.
Yes. Well, I did want to say, and I know you might not like this because you're fairly humble, but you know, most of the plastic surgeons that I saw, it seemed like they felt like they were the celebrity, or you know, not all, but I'm blocking several into a group here. And I felt here like I was a celebrity, but you are a celebrity.
No, I will tell you, I'm just doing my job.
I know.
From the very beginning, yeah.
I know. I absolutely know that. And but you don't act like that. You know, you're not haughty or anything. You're very caring and very thoughtful and very professional in all ways. And I just am so grateful to have had this surgery and experience with you.
No, thank you. You know, I will tell you, I have a lot of plastic surgery friends, you know, a lot of plastic surgeon friends, and I'll tell you, and many other surgeon friends, from cardiothoracic surgeons to a lot of other entrepreneurs and businessmen. You know, I will tell you, we're all equal. We're all one. Yes. Just sometimes what sets us apart, it's truly not, it's the humbleness. You know, you have to be humble, you have to be down to earth, because there is no, we're all equal, you know, and so, you know, I tell the patients, there is no judgment as to where that other person is from or where they're from, and no one should act arrogant, and I know exactly what you're talking about. So You know, and on the same note, I want to mention, you know, we have to respect the human body.
Yes.
When I use the word respect the human body, meaning we're not doing BBLs, for example, because that is making a mockery out of the human body, I say. And now this is my belief, my judgment, my values, if you will. Do no harm. That is the single most important factor. We don't want to do a surgery where we look back in 5, 10, 15 years and say you were harmed by these implants, for example, and that we respect the human body in every way and regard, so that everyone has peace of mind, quality of life, longevity, and no misery of the implants, and no hurt from the implants.
Yes.
Yeah.
Yes.
So, now let me ask you this: how was your anesthesia experience?
I wanted to talk to you guys for a few more minutes before I was asleep.
Yeah, yes.
No, it was very casual.
Yeah,
it was a very beautiful room to come into. No problems whatsoever.
Right.
Yeah.
How much? Now you did get the Exparel,
Yes.
so that certainly helps. Now, how was your pain experience?
My pain, I think I had a wrong perception of just the totality of pain control that Exparel would give me. And so I was a little surprised at the pain that I had, but it was controllable, and it made me realize it was a good reminder of what had happened to my body. So it wasn't that it was a bad experience, but it was a good experience, but it hurt.
Right. No, I will tell you, if you just look at the pictures and the videos,
Yeah.
I want everyone who can, and again, this is part of the informed consent, please go to my YouTube, and under the videos, go to the latest. You will see I am now putting up, Mar from our office is putting up high definition videos of the dissection itself, so that one can see the invasiveness of the surgery, and they can truly comprehend. And you can only imagine the blood loss is less than 5 cc's on well over 99.5, 99.7% of the patients, and that overall it's very controlled, very contained, and almost everyone has literally less than 5 cc's of blood loss. So you can see firsthand exactly the nature and extent of the surgery and the intensity of the surgery, and then post-op, between the pain meds, between the bra binder, between the Exparel, and the pain medications that we give the patients overall tolerate what is an involved surgery. Putting in the implants takes 45 minutes to an hour or less. In one plastic surgeon I interviewed, he said it took 10 minutes for him to put in saline implants. And the removal is a totally different beast, because it requires a totally different mindset, totally different undertaking. Now, on my end, I will end by your words. What do you have to tell the next lady who's listening to you from your experience? What is it that you want to share with the rest of the world?
Oh, you know, I understand why we as women, and even other people, get any kind of implant at all. But if you get the implant based upon the fact that you wish your clothes felt better, that's a practical thing. But if you get an implants because you want to be more beautiful, or because you want to look better, or you want more attention, or whatever the case may be, it's not worth it. You will never get to the other side of who you are and what you have to offer the world and what you have to gain from the world if you cover up just the way you are with something that's false. And then there is the consequence of it. There is the consequence of the illness. There's the consequence of needing to have them out, and the maintenance. And for me, it was a consequence of a little bit too much attention, you know, in my life, and so it is never worth it.
Mark, can you give me that? Yeah. So very well, thoughtfully said. You know, it's not worth it, and it's do no harm.
Yes.
And I just want to mention there are many patients that I talk to, and I'll end with this. These are not my words. Breast, quote unquote, this is the warning on the Mentor advertisement. Quote, breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Number 2, breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIALCL. This cancer occurs more commonly in patients with textured breast implants than smooth. Smooth are also implicated. although rates are not well defined, some patients have died from BILCL. Now, this is the warning as is. This is what every patient must be reading. And last but not least, and I'll end with this, patients receiving breast implants have reported a variety of systemic symptoms such as joint pain, muscle aches, confusion, fatigue, autoimmune diseases, and others. So some surgeons have said, well, BI does not exist. Guess what? The manufacturers are telling you it exists. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement, close quotes. So complete resolution, that means there is a cure. So we will see. I heard the symptom improvement that you had. You know, you're 72 hours out. We'd love to do another Facebook Live with you maybe in the next couple of months so that we can see where to follow from this.
That would be wonderful. Thank you.
Thanks very much for sharing your journey. Continue to please follow. We have a lot of Facebook Lives coming up, Instagram Lives, TikTok Lives, YouTube Lives, and we want to go ahead and share the journey from our clinic so that we can educate and essentially reinforce what the manufacturers and what the FDA has highlighted many times over the years.
Yes.
All right, thank you.